Hello, I'm Dr. Grady, and welcome to the Functional Medicine, Functional Neurology section of the HealthQuest website. If you are online right now watching this video, you or someone you love is suffering from a chronic condition, and you are looking for answers. Well, I'm here to tell you you've come to the right place. Right. We do things a little differently and very effective, so you're not going to get the same run around here. So before we go into what makes us different and everything that we do, let me tell you a little bit about myself. As I mentioned earlier, my name is Dr. Grady. I am a National Board Certified Doctor of Chiropractic. I am a graduate of Functional Medicine University and a certified functional medicine practitioner. I am currently pursuing my postdoctorate degree in chiropractic neurology, and I am also a member of the Neurometabolic Supergroup. We are a group of over 1,000 doctors across the country that practice in this way, and we are constantly learning from each other and finding the new and best therapies in order to treat these conditions. So, what you're here to learn is, what can we help you with? Well, many of the common conditions that we see are migraines. Migraines are very common headaches. They can be life-changing. They are, a lot of times they stop you from, doing many of the things you would like to do. And not many people really know what to do with these. You take your medications when you feel something coming on, and sometimes it helps and sometimes it doesn't, or it works for a little while and then you have to change. So it's this doctor drug merry-go-round that you tend to be on. But we have very good results for treating these. We treat a lot of chronic pain syndromes such as fibromyalgia. Okay. The last one on the list, chronic disc pain, stenosis, sciatica, just pain that you've had for a long time. Very often just taking medications is not going to really correct the problem, but there's underlying conditions going on and things that need to be addressed, and that is what we get to. Other things, diabetes or prediabetes. If you have a problem regulating your blood sugars, blood sugar dysregulation is the #1 stressor in the body, and it will cause many things to go awry. So you need to get that under control. We work with vertigo, dizziness, autoimmune disorders. Some examples of autoimmune disorders would be multiple sclerosis, Hashimoto's thyroiditis. Okay? Approximately 90% of hypothyroid conditions are autoimmune related. Sleep disorders are very common with many of these chronic conditions. Neurodegenerative conditions, and we also take a neurometabolic approach to weight loss. This is for people who've tried everything under the sun, exercise, every kind of diet that has come down the pike, and you still can't lose the weight. There's probably something underlying, a reason why you can't lose the weight, and that's what we explore. So what most people want to know is, why me? Did fibromyalgia just fall out of the clouds, hit you on the head one day, and now there you go, now you have it? Or is it migraines, or whatever the condition may be? And the answer is no. The common underlying cause of many chronic conditions is stress. Stress comes in three main types. You have physical, chemical, and emotional. So physical stress would be if you sit at a desk all day and you're hunched over, you're in a flex posture, your head's down, your head's forward. That puts a lot of pressure on your joints. That can create a pain syndrome in and of itself. So we have to work on that. Chemical stress. And chemical stresses come from the medications we take. They come from supplements that we take. It may be supplements that are poorly made or supplements that we don't even need. And if you don't need them, your body does not want them, and it will create a response to that. Our environment. We have approximately 80,000 different pollutants in our environment. Any combination of these can cause a problem in the body. Another big one, especially these days, is emotional stress, whether it's related to the marriage, whether it's kids, whether it's money, whether it's family, all stress, all emotional stress, and you need to address it. You need to, tends to be the hardest one to focus on, but it is very important to address. We're talking about chronic conditions. We need to address autoimmunity. Autoimmunity is when your immune system starts to attack your own body. This obviously not a good thing. There are two main components to the immune system. There are others, but these are the two main ones, the Th1 and Th2 systems. Th1 are like the little Pac-Man of the body. They go around, gobble stuff up, like all the bacteria, viruses, everything that needs to be taken care of. The Th2 system are the ones that put the labels on the bad guys, and then the Th1 system comes along and gobbles those up. If you have an overactivity of one of those systems, they will attack the foreign invaders, which is good, but then they will not stop and they'll start to attack your own body. Not a good thing. For example, in Hashimoto's thyroiditis, the immune system starts to attack the thyroid gland. You don't want that. So that has to be addressed. If not, anything you do, you might feel better for a little bit. It's not going to last because that autoimmune reaction is still going on. So what you need to ask is, well, how do you stop your immune system from attacking your body? Okay? You need to decrease inflammation, you need to detoxify the body, okay? And you need to build up the immune system. So, but building up the immune system, if your Th1 is too high, then you need to build up the Th2. Okay? And you also need to support the immune system overall. Very, very important. Decreasing inflammation, this can come from foods that you're sensitive to. Okay? So finding out foods that create an inflammatory reaction in your body, you got to get rid of those. And detoxifying the body. If you can't detoxify through the liver, the gallbladder, these inflammatory chemicals that your body has chewed up and wants to get rid of, it can't. They get recirculated throughout the body. Again, you're keeping that immune response going, that inflammatory response going. These are the underlying conditions that really need to be addressed. So in functional medicine, there are two huge points that need to be considered. 80% of your immune system is in your gut. So if you have a problem with your gut, whether it's a leaky gut, a parasite, anything in there that's keeping your gut function from being normal, you cannot truly heal, and you are going to have some sort of an immune reaction constantly going on inside your body. So in order to truly heal, you have to have proper gut function. The big point number 2, there's a very strong gut-brain connection. So if you have inflammation in your gut, you have inflammation in your brain. And inflammation in the brain causes a lot of signs like brain fog. Right? Why did I come in this room? Or I was going to tell you something, but I can't really remember what it was. A lot of that, and a lot of you can't retain information. Just, all these signs of not concentrating. People think you're not paying attention to them, and it's not that. It's just your brain is not functioning properly. So you have to address both. You have to address the gut, and you have to address the brain. So this is where our approach to treatment comes in, and this is why it is so effective. Our approach is called the neurometabolic approach. We treat patients neurologically and we treat patients metabolically. Okay? So we address the central nervous system, like the brain, the spinal cord, through certain exercises, and then metabolically through nutrition, and we test to find out what you need to have. We don't just throw stuff on the wall and hope things stick, and we get specific. So we kind of hit this a little bit, but our 3-pronged approach is we treat neurologically, nutritionally, so not just supplements and not just high-grade supplements, but cleaning up the diet, making sure we get rid of foods that you are sensitive to, and also structurally. So if you're sitting at a desk all day and you have, the bad posture, constantly stiff, your neck is stiff, your back is stiff. We have to take care of that because that is a chronic stress on the body that is not going to do you any good. So what's involved? Everything from the comprehensive health history. We do a very detailed physical exam, especially a very detailed neurological exam. We get complete blood work, okay? From lipid panels, the thyroid panels, complete metabolic panels, the CBC with white blood cell count, the whole 9 yards. We're going to check it all out. Advanced laboratory testing. These are tests like adrenal stress index, organic acids, maybe a stool test. You got to see what's going on inside the body to really know how to fix it. We look for food sensitivities and food reactivities inside of your body. We've hit this a couple times, but again, if there's something that you are sensitive to, it creates an immune reaction. You have a constant inflammatory cycle going on inside of your body. You can't get any better because constant inflammation. And a lot of our in-office therapies include brain-based therapies. This is like working out your central nervous system. So like the same way you work out your arms like a bicep curl, okay? You can work out your central nervous system through eye exercises, through sensory. So we use light, sound, just working those pathways out. It's actually pretty cool. So our goals in this office are 3 big goals. We have to get you better. It's all about the results, right? You want to get better, and in order for us to say we did our job, you have to get better. We want to help you reinvent your life. We don't want you to have to live your life according to when your next doctor's appointment is going to be. And that's where the 3rd one comes in. Get you off the doctor's office merry-go-round, okay? From doctor to doctor to doctor to doctor, whether it's conventional medicine, alternative medicine, and just back and forth, but no one's really getting to the heart of the problem. And that's what we are going to do. So thank you, and we hope to see you soon.